Dr. Henry, with NACI's changing guidance today around boosters for 12 to 17-year-olds, where is the province at with offering that age group the boosters? And to the larger issue today, as we plan towards Family Day and easing those restrictions, what do you say to the most vulnerable who won't be able to keep up in terms of their risk will still very much exist as many people are just moving on?
Yeah, it is all about balance, and that is why we still have things in place and why we reinforce, as I've mentioned, we reinforce the importance that each of us does around reducing risk in our own family, for ourselves, for our family, our community. So as each of us gets vaccinated, it makes a difference in the amount of virus that's circulating in our community, and that in itself protects those who are most vulnerable. And yes, people who have these innate vulnerabilities, whether it's because of the immune system, because it's cancer treatments, because of age and underlying illnesses, we all need to take additional measures to protect them, and they need to continue to take additional measures to avoid some of the higher risk settings until the virus is at a low enough level. So it is going to be different for each of us based on our risk of the activities that we'll be able or want to partake in, and the measures that we'll need to use as we have less and less, hopefully, of this virus circulating. So it really is titrating our own risk with the measures that we know work and the situations that we're going to be in. So right now, the important thing is that all of us need to continue to take these active measures, whether it's vaccination and masking and keeping our groups small, because that's how we are dampening down the amount of virus that's transmitting, and that protects everyone. In terms of the NACI statement for 12 to 17, that is something that we've been discussing and we're expecting. So we've been discussing it with our BC Immunization Committee and looking at what this means for our program here. And we have another meeting with, as I mentioned today, that we have a large team that we work together on these issues and find out think through what is the best way to approach this from BC's perspective. And we'll be coming out with our plan starting sometime next week. So next Tuesday I'll be able to talk to it in more detail. So we're also looking at the information that NACI used to make those decisions, as well as what other jurisdictions are doing around the world. So there's lots of pros and cons, and I'll be talk more about some of those details next week.
Richard, do you have a follow-up?
This week, Dr. Henry, we saw some of the highest days of COVID-related deaths. Who is still dying here? Are these cases linked to long-term care? And, is enough being done to prevent these deaths from happening? And for Minister Dix, unrelated to COVID, there's been another clinic closed in Victoria in terms of family doctor support. What is the province doing to address a shortage of family doctors and to support, hundreds, if not more, people who no longer have a connection to the primary care system?
Yeah, the people who die from COVID and with COVID has always been part of the tragedy of this pandemic. It is something that we've been watching and measuring in a way that we don't for many other illnesses. So yes, about 40% of the people who've died in this month have been related to outbreaks in long-term care. Most of the people who are dying outside of those outbreaks are older people with underlying illnesses. A high proportion of them are people who don't have the protection from vaccination. We have had younger people die as well. Some of that are people who were infected with Delta. We know that it caused more severe illness, and it's people who've been in hospital for some time, for example. And some of it is the fact that this virus, even in its form that it is now, the Omicron strain, does cause severe illness in some people. So most of the younger people that we've had, at least this week, 2 people in their 40s who've died from COVID. We've had younger people as well, and younger tend to be people who are not yet vaccinated and don't have that protection. And many have other underlying causes, as we know. But age is the number one most important risk factor, and about 40% of people are people in long-term care. And we have talked a little bit about what we're seeing in long-term care right now, because we have such high rates of vaccination in residents and in staff, and high rates of booster doses. We're seeing very mild illness, but we count everybody who has a positive COVID test and dies within 30 days of that test as being, we've always recognized that COVID could play a role in those people's deaths, unfortunately.
So obviously there are significant challenges facing, especially in some parts of the province, our primary care system. One of the key challenges is that fundamentally the system that has been in place for the support and funding of private primary care is not best suited to the current times, and that's why we've been undertaking a transformation well before COVID, in fact since 2017, of our primary care system, focusing on team-based care. So you've seen the development of more than 24 urgent and primary care centers, but also dozens of primary care networks which support our existing primary care systems, not to the side of it, but our existing systems, including here on the South Island. Creation of new community health centers, the addition of additional supports for First Nations led primary care initiatives as well. So you see that, and a move to team-based care, allowing a variety of healthcare professionals to work to the full extent of their skills. We've also seen, compared to other jurisdictions in Canada, an increase in family practice doctors relative to other jurisdictions. But there are significant challenges. Our existing system is based when a clinic closes, and that's happened, and this is particularly an issue in the South Island. It's a great worry for people, particularly people with chronic diseases who are older, who need healthcare services, and that's why we're doing a lot of work right now here on the South Island with local divisions of family practice to address these problems, because it's not just creating new services which do support us and have been invaluable during the COVID-19 pandemic and building out team-based care, but it's also important to stabilize systems. So that work is being done with local doctors now. I want to emphasize that our core initiative in reforming primary care are primary care networks, which come from local divisions of family practice. So this involves working with doctors, and we've succeeded in doing this in almost 50 communities across BC and community health service areas across BC, where proposals from local divisions of family practice, from local nurse practitioners, come forward, and those proposals are supported and funded. And as a result, more than 800 new staff have been added to support primary care across the province, which is a significant achievement. There is more to do on the South Island. We're working closely with family practice doctors to address the present situation, present some of the challenges that COVID-19 has brought here, and that's true across BC as well. So that's the work that's happening now. There is a significant initiative in place. Clearly more needs to be done, and we're acting on that, as I noted in my initial remarks.